Good evening to you and welcome to The Story. I'm Evan Watson. Thanks for joining us. Tonight, let's look at healthcare and, importantly, healthcare accessibility. To get the quality care you need, it shouldn't matter where you live. But we know it's not that simple. Patient outcomes can be tied to patient access. And for some, that concern is poignantly relevant right now. It's tonight's big story. Medical provider Adventist Health Tillamook recently announced it was closing 3 rural health clinics in Oregon. The decision leaves thousands of people without a doctor nearby. The company said it had no choice but to close the clinics due to long-standing staffing issues, a problem that's plagued rural healthcare nationwide. Thomas Schultz has this story.
Up near Mount Hood, along the Salmon River, is the small town of Welches, a town which for almost 40 years has been served by this clinic.
I know they were really busy.
Though now, that's changing. Last week, Adventist Health Tillamook announced they were closing the Welches office, shocking the town.
You would think it'd be to their advantage to keep it open.
And their landlord.
Well, this was a huge surprise.
In a press release, Adventist Health says they're closing the clinic due to long-standing staffing issues. Though some residents don't buy it.
Well, there was a doctor here that was here for 38 years. So, and they had him replaced before he was gone.
In a follow-up statement, the company says they're dedicated to serving Welches and the Mount Hood community and say patients can go to the nearest clinic in Sandy, a little over 20 minutes away.
I know that the clinics in Sandy, they're already pretty busy and understaffed, as most businesses are. And so it's going to be difficult trying to find a new doctor.
Some are already looking past Sandy to Gresham for a new doctor, a choice they aren't happy about.
If you're deathly ill, you don't want to drive 45 minutes.
And Welches isn't the only clinic Adventist Health is shutting down due to staffing. Lincoln City and Sheridan are closing too.
This is kind of like a landmark.
Elizabeth Jack Porky lives on the same street as the Sheridan Clinic. She says its closure will worsen health care for many in her town.
All those residents who have gone there for years have to now travel an extra half hour.
And staffing issues are causing clinics to shut down nationwide. Last year, the Health Resources and Services Administration issued a report showing 65% of rural areas had shortages of primary care physicians.
I don't think there's quite an end in sight.
Dr. Eric Weiser, OHSU's Dean of Rural Medical Education, says for years, Oregon's rural health care has slowly deteriorated. That's partly due to a move in medicine to specialization and away from general care. And most specialists train and work in urban areas, leaving a shortage in rural places.
It's going to be stressful for those communities to find care.
A stress people in Welches are already facing as they search for a new doctor somewhere.
We're going to have to find a doctor that's actually taking patients. That'll be the first step.
Thomas Schultz, KGW News.